This is Maria. She just came home from work early because she's having chest pain and shortness of breath. Maria is a newcomer to Canada. She's worried about her health, but she's never called 911 or been to a hospital in Canada before. After some hesitation, Maria decides to call 911. And paramedics arrive quickly to take Maria to the hospital. In the ambulance, Maria struggles to keep up with the paramedics, as English is her second language. Maria's worries are increasing by the minute, and although the paramedics are kind and professional, she feels frightened and confused. Maria gets to the hospital and receives the medical attention she requires. However, she experienced a lot of additional stress and discomfort as a result of calling 911. Unfortunately, Maria's experience is not unlike many who call 911. The city of Toronto is tremendously diverse, with approximately 250 different ethnicities and over 60,000 new permanent residents each year. However, the healthcare system in Toronto does not always address or consider this diversity appropriately. Receiving medical attention is already a stressful, overwhelming, and unfamiliar experience for many. But when culturally appropriate care is provided, we know that health outcomes are improved and health disparities are reduced. So how can culturally sensitive emergency medical care be provided? Introducing Call for Backup, an organization that provides support workers to patients and their families when they call 911 for emergency medical services. The support workers would attend the call to provide emotional support, advocate on the patient's behalf, provide further clarification, connect the patient to other culturally appropriate resources, or act as an intermediary for the individual and family when receiving medical attention. When someone calls 911 to receive medical attention, they would be provided with the opportunity to request a patient support worker. To provide high-quality professional support workers, Call for Backup will foster partnerships between the City of Toronto and different ethnic or culturally specific organizations. This will include newcomer, faith-based, and LGBTQ organizations, multicultural health centers, and friendship centers. Call for Backup will partner with as many organizations as possible in order to represent the wide diversity that exists in Toronto. Together, the partner organizations and Call for Backup will recruit, hire, and train volunteers for the role of patient support worker. Another important part of the program will be paramedic training. Partner organizations will provide ongoing training and education to paramedics to increase their capacity in providing trauma-informed and culturally appropriate emergency medical assistance. This training will also foster relationships between the support workers and paramedics to improve coordination during calls. To raise awareness about the organization, a public awareness campaign will take place. Organizations that work with communities or individuals who may benefit from this service may also be asked to inform their clients of our organization. Although patient support workers will be volunteers, there will be several staff responsible for training and supporting volunteers. This will be funded in 3 ways. First, the organization will apply for grants within the City of Toronto and Greater Toronto Area. Next, the organization will look for provincial or federal grants that are available. Finally, the organization will sell its services such as cultural competency training for healthcare workers to external parties in order to create long-term sustainability. There will be 2 streams of evaluation. First, the targeted goals for patients and their families who use the program will be increased coping capacity, increased self-determination, decreased negative affect, and decreased anxiety or stress during the call. To measure this, we will use qualitative and quantitative measures and ask patients and their families to report their experience after leaving the hospital. We will also look at the number of clients accessing the organization's services and the number of patients who have used the service multiple times. For paramedic staff, the goal will be to increase community building, increase knowledge and skills, and increase competency in providing culturally sensitive care. To measure the second stream, we would ask paramedics how they're responding to the service both on the road and in the training sessions. We would also look to see if there are any additional changes in policy pertaining to diversity of patients, which may indicate further disruption is taking place. We will also acquire information directly from different communities and community organizations regarding the service's effectiveness and usefulness. We will also explore developmental evaluation because partner organizations may provide insight into what specific cultural or ethnic groups experience when accessing emergency medical services. Call for Backup aims to disrupt the current idea that culture and diversity do not play a significant role in the treatment and care of patients, and that the medical model does not need to consider culture in order to be effective. Call for Backup also aims to disrupt the notion that receiving medical attention from paramedics is not emotionally taxing or challenging for both the patient and their family. Call for Backup provides patients and their families with the culturally sensitive support they deserve while allowing paramedics to focus on their medical protocols. By improving the quality of emergency medicine, we can improve health outcomes and decrease health disparities in our city.